Welcome back to my channel. So today's video is a deeply personal one. Recently I was diagnosed with a large ovarian mass, a large annexal mass, and I have been on a journey trying to figure out exactly what it is. So I have spoken extensively on my previous video about what has been done so far, blood tests, ultrasound scan, CT scan. So my CA125 blood test results came back and the levels were quite high, 326 to be exact. So the doctors aren't exactly sure yet if this is endometrioma, endometriosis, or potentially ovarian cancer. And I have been referred for an MRI scan to learn a bit more. So just so you know, a CA125 is a cancer antigen, a tumor marker that determines the number of cancer cells in your blood. So mine came back quite high. I think the normal level should be under 30. So, right. Well, I am sharing this because I know that I am definitely not alone. I have been online and I have realized so many women are going through this. And I am one to always talk about my health challenges. So I want to create a space where we can talk openly without shame and support each other and learn from each other's experiences. Because I know this can be quite a difficult thing to go through for most people, for me especially. So well, my current journey, let me just take a moment to explain where I am at in this process. So it all started just over 2 weeks ago, and I was having severe lower abdominal pain on my left side. It was taking over my life. And I was also experiencing persistent bloating, quite a lot of discomfort, urge to urinate, quite a bit of discharge, pain during intercourse, so losing my appetite, and all this was quite strange. Back and forth I was going to the doctors, nothing was being done, so I decided to get myself into hospital where a CT scan was ordered, and that's when it was found that I have a large ovarian mass. So one of the tests that was ordered was the CA125, which is a marker in the blood, and that can be elevated, So after having all these symptoms, I decided to check myself into hospital, and a CT scan was ordered where it was discovered that I have a large ovarian mass on my left ovary. So I was ordered to have an ultrasound scan, which I did, a transvaginal ultrasound and some swabs, biopsies and things. And also a CA125 blood test, which is a marker of the blood that can be elevated, for several reasons. And whilst high levels like mine, 326, can be associated with ovarian cancer, they can also be caused by other conditions like endometriosis and endometrioma, or even inflammation in the body. So whilst it is unsettling, it is not a definitive diagnosis. So you can imagine what I am going through right now, not knowing what this is, and I am anxiously waiting to get a proper diagnosis. So why am I sharing this? Well, if I'm being honest, this has been a roller coaster of emotions, waiting for answers. It's been difficult, and I know that many of you who might be watching this have been through, something similar, or somebody that has been through or is going through something similar. That's why I want to share this part of my journey, because I know that this is a journey. I have been told I will have to have surgery, whatever the situation might be. And this is not only just to update you, but to ask for your insights and your experiences. If you've gone through, something similar, or if you are going through something similar, whether it was endometriosis, an ovarian cyst, or even cancer, I'd love to hear from you, in the comment section. What was your experience like? So, what am I learning and expecting so far? Well, here's what I've learned so far and what I'm expecting moving forward. The next step is to have an MRI scan, which I think is something that should have been done in the first instance, but what do I know? So an MRI scan is a more detailed imaging test that can help the doctors to determine the nature of the mass, or to know exactly what this is, whether it is solid, fluid filled, or something else. So it will give them the characteristics of the mass, will give them a bit more detailed information, and it does help in differentiating between a benign and a malignant mass. So an MRI provides a more detailed imaging of the reproductive organs. So I say that because I am a radiographer and I used to do MRI scans. And it can also guide the next steps in diagnosis and treatment. So I am quite keen on knowing, the outcome of the MRI scan. So I'm preparing for all these by writing as much as I can, all the questions for the doctors, and staying as calm as possible, which I think is the most difficult thing to do. It is so overwhelming, so much information coming in. Some of them I do not understand. So it is daunting. And but I am trying my very best to stay as calm and informed as I possibly can. But let's be real, this process is not easy, and if you have gone through this, you know what I am talking about. And for those who are going through it, it's okay to feel scared, uncertain, or overwhelmed, because I tell you, I have all those emotions going through me. And it's okay because you're only human, but you have to be positive. And my advice to anyone who is in a similar situation is for you to look after yourself. Make sure you advocate for yourself, because this is some of the things that have helped me. Advocate for yourself. Ask questions. No question is a stupid question, because this is your life. This is your life. Do take care of yourself. Sleep well. And I know it's easier said than done, but it's quite important for you to have enough rest, eat nourishing food, and find, small moments of joy or relaxation in your day. I know it's easier said than done. Again, when I got the diagnosis in the first instance, I did not sleep the whole night. And that was a very bad thing to do. And very importantly, trust your instincts. Trust your instinct. If something feels off in your body, do not ignore it. You know yourself better than anyone else. And I'm reaching out because I believe in the power of shared experiences. I always talk about my experience living with a chronic illness, and this is not going to be any different. If you have faced a similar diagnosis, I'd love to hear your story. What symptoms led you to seek help? What test did you find helpful? And what advice would you give to someone just starting this journey? And whoever is starting this journey, just know that you are not alone. You are not alone, and do not face it alone. I know every journey is different, but I also know that hearing from others can bring so much clarity and comfort during uncertain times. Again, like I said, when I first got the diagnosis, I did not sleep the whole night. I was on the internet looking for all kinds of information and looking through the four walls of my hospital room, which was a really bad thing to do. But we've moved on from that. We're staying positive. We're staying positive. And my final thoughts really are that you should look after yourself, take care of you, and whatever the outcome, you have to be prepared to face it with positivity, because I believe that we have the power to control how we feel, and it's up to you to let things beat you. So thank you for taking the time to listen to my story. This is a challenging chapter in my life, but I believe that by sharing we can create a supportive community for anyone who is going through, something similar. I'm always one to talk about my experiences in life. I talk about living with a chronic illness, and my experience has helped a lot of people who are going through a similar situation. So this is no different. If you've been through this, or you know someone who has, please share your experiences in the comments. And if you're currently navigating something like this, know that you are not alone. You are definitely not alone. So let's keep this conversation going, and we can learn and grow together. There's so many things that I still don't understand. I am doing my best to understand, a lot more about endometriosis, endometrioma, and possibly ovarian cancer, which I already knew a bit about, but this is all too overwhelming. So we are in this together, and I am staying very positive, and so should you. So thank you for watching, and don't forget to like this video, share with someone who might find this helpful, and subscribe for more updates on my journey and more content about women's health, because I will definitely be updating you as I go along. I have been told that I will be having surgery, whatever the diagnosis might be, because the mass is quite large in my ovary, and it is affecting, my kidneys, my colon, and my liver. So whatever this diagnosis is, this mass has to come out.